You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with gum recession. With us, we have an expert on the topic, Dr. Alina Krivitsky. Dr. Krivitsky, welcome to the program.
Thank you so much, Randy. It's a pleasure to be here.
Now, for people that don't know your practice, because you do a lot of things as a periodontist, but today we wanted you to talk about gum recession. Who's the typical gum recession patient?
It's a great question, Randy. We actually don't have a particular type of patient. We have several types of patients that come to see us for gum recession. One of them in particular, the major type, is the type that experiences a lot of cold sensitivity, sweet sensitivity, anything that doesn't allow them to eat properly or use their teeth comfortably. And the second type of patient is a patient that experiences an appearance problem, somebody that has really long teeth in the front. They're really self-conscious about taking pictures. Their teeth look longer. They look asymmetrical.
Because
They're
of the
not
recession in the front.
Absolutely.
Is that caused by brushing?
So that's a really good question. A lot of people think that, but it's not only caused by aggressive brushing. That would be a more appropriate way to describe it. It's really the traumatic brushing using a hard toothbrush, brushing using really, really harsh techniques, going back and forth, the way we were taught, the way you saw things in commercials before, just scrubbing our teeth. So that's definitely a huge thing that can cause gum recession. But also gum disease. Gum disease are a huge factor that can cause gum recession. We know today that CDC shares with us that at least 70% of patients over the age of 65 have some sort of gum disease, infectious disease in their mouth.
So it's like a bacterial infection?
It is a bacterial infection, absolutely.
And that could cause the gums to recede?
Absolutely, Randy. It can cause gums to recede. It can cause bone loss, inflammation that causes tissue loss, gums loss as well, and can make the tooth look longer and not very aesthetically pleasing.
But you could fix it?
Absolutely.
Okay. I interrupted. The third category?
Okay, so the third category of patients are patients that have seen the dentist. They have expressed a concern that they have longer teeth or teeth that are not matching in height in the front. And their dentist says that the only solution is to put a filling on their roots, which doesn't really resolve their problem because it still makes the tooth look longer and also makes it really hard for them to clean over time.
So I'm following this correctly. So the gum is... You have gum recession, and then they put filling material over the gum recession.
Absolutely. They can.
But does the cold sensitivity go away?
So sometimes it can help with cold sensitivity, and this is the main reason why dentists do this. But unfortunately, with time, it doesn't protect it from progressing or getting worse. Absolutely not.
You don't like it?
I do not like fillings because they do cause patients to be it's very difficult for the patients to clean, and it also predisposes them to cavities over time, which can contribute to tooth loss.
Now you treat it, we've talked on the phone, differently than most dentists, most periodontists across the country. Is that fair to say?
It is fair to say.
And you also teach this to other dentists across the country.
Absolutely.
As a lecturer.
Yes, we do. Now, it's fair to say that I was trained in a very traditional way, and I did practice traditional gum grafting for many years until we discovered a newer technique. And now we obviously teach other dentists. We want to share with everyone that there is something that is more comfortable and better for our patients.
Okay, so gum recession. I guess there's 2 or 3 ways to treat it. How is it typically done the majority of the time, and how do you do it?
So typically, and what we see on the internet, on Google out there, and what patients see, is typically a piece of tissue, piece of gum, is taken from the roof of the mouth and transplanted to an area that is missing tissue that has gum recession. So obviously, it's a good technique that's been around from 1960s, but...
This is your training.
Absolutely.
As a periodontist, they taught you this.
Yes, that's what I learned at USC.
You say it hurts.
It definitely hurts because we're looking at 2 different areas of surgery. So the patient experiences pain in 2 different areas of their mouth. And because we have to take a pretty large piece and basically sew it back on into another area, now you have stitches in 2 areas. Now you have bleeding in 2 areas. So the patient is not so quick to go back to work. In fact, it's so difficult for them that we can't really get them to do more than 1 area at a time. The problem with taking tissue from the roof roof of the mouth is that there is a limited amount of tissue we can take at one given time.
Okay.
So usually we have to tell our patients that you have to have multiple surgeries if the recession is in more than one area. And very frankly, I'll tell you that I could never get my patients to come in for more than 2 surgeries.
Because of the pain involved.
Absolutely.
I mean, during the procedure, they're numbed up, but the healing time is what hurts.
The healing time and the way you have to modify your lifestyle afterwards is just so complicated to figure out that not a lot of patients come
So
back.
gum recession, they just patch on other tissue from the mouth
Absolutely.
on top.
Now, another thing is that it doesn't look quite the same. Sometimes taking tissue from another place from the mouth just doesn't quite match very well. And a lot of times it makes patients very self-conscious, especially when it's in the front of their mouth. When they smile, they can see a little patch of tissue there. And what I see with these patients that come in that had it done, they always apologize for this area. They will say, I am so sorry. I know I have a little weird looking piece of tissue there, but that's because I had a graft done 10 years ago. And it never goes away. So, as a matter of fact, the traditional way, the old way, is being done all over the place every day.
Like how many would you say, even today?
Several hundred, probably going on just in California alone a day.
So, do you believe it's not effective? Or there's a better way?
There's definitely a better way. It is effective, for
Okay.
sure. However, I do think that we have several advantages with doing it the newer way that we were really shortcoming in the past.
Now, what about this other technique where they literally pull the gums down and then they're able to make them stay there? Because it logically sounds like a good way to go.
It is a very logical.
You're familiar with what I'm talking about?
Very much so. I'm very familiar because I teach these techniques to other dentists.
Okay.
And there are many other techniques to do gum grafting. There's no one way. But what we believe is this technique is different in the sense that the other technique you were talking about basically uses non-autogenous or non-patient tissue. It uses porcine collagen. Porcine collagen, number one, can be pretty expensive because to do a full mouth grafting for somebody who has a lot of recession, you have to open a lot of packages of the material that you have to buy.
Okay.
So it gets really expensive for patients. Number two, this technique does not involve stitches. And now this can work well in the upper teeth because we're working with gravity. We're trying to pull down tissue and it kind of stays there. But on the bottom teeth, we're working against gravity. So this doesn't quite work very well. And what I see is a lot of patients coming in after that technique that are requiring revision because the bottom teeth didn't work so well. Now, the third reason is when you use porcine collagen, some patients cannot or not able to use it or not able to allow you to use it because they, for religious reasons, or for whatever philosophies.
It's not a very holistic way to go.
It's not a very holistic way to go.
Okay.
So, definitely for those reasons, this may not be the most optimal technique because there's a better way to do it.
Okay, so let's talk about the way you're doing it.
All right.
So for people just tuning in, we're talking about a new treatment option for people with gum recession, even full mouth gum recession. So what are you doing?
So basically, full mouth gum recession is kind of forte of my practice. This is what I do.
Is that unusual though, or there's a lot of people with full mouth gum recession?
You would think that, but I do full mouth gum recession at least 3 times a week.
Okay.
So there are plenty of patients that have a lot of gum recession. Not every patient, we obviously treat them per what they need and only the teeth that have it, but there is a pretty large population, especially patients who have gone through a very long orthodontic treatment that have parafunctional habits such as grinding, which affects at least 50% of our population today. And patients that have been or have a history of really aggressive toothbrushing where their parent or TV or somebody in school has taught them to use a medium or hard toothbrush.
So what do you do?
So what we do is we use a technique that uses practically no incisions. There are very, very 2 small areas that I open where we tunnel the tissue under the gums of the patient underneath, and we're able to, with two little tiny areas, to go ahead and make the gums a little bit looser, where we can pull them down like a little curtain and cover the exposed roots. Now, as a grafting material, because we want to now promote and thicken those gums that have thinned over the years and that the patient has lost, instead of using tissue from the roof of the mouth or from other origins such as animal products or cadaver tissue, what we do is we use their own growth factors called platelet-rich fibrin. And this platelet-rich fibrin is so easy to harvest and so inexpensive.
So you take their own blood and is it like PRP
it comes
at all?
So PRP is very similar.
Because they use that in cosmetic procedures and more dentists.
Absolutely. PRP came about when Kobe Bryant tore his Achilles tendon. This was years ago, and I remember hearing about it where he had to go to Germany actually to get that repaired. And it was a good stepping stone in this type of technology. However, PRP, platelet-rich plasma, is a liquid. So it's very difficult for us to keep it inside the mouth.
Okay.
The newer generation that we use today is a platelet-rich fibrin, which is essentially a blood clot. And everybody knows that blood clot is where the healing comes from in our body, no matter what we're trying to heal.
So you use their own blood, you spin it
Absolutely.
in a machine.
Very easy. Just take it from their arm. Now, most of our patients are put into twilight sleep, so they're very comfortable. They have a port. We can just go ahead and draw their blood from the same area and rehydrate them right after.
Okay.
We put it in a centrifuge machine that spins it and basically allows us to separate all the great things, the healing potential of that particular patient, their own growth factors and cells, that we can now have a physical form, kind of looking like a little jello, if you say, and basically insert them into little tunnels that we've created
under the gums.
Under the gums.
The receded gums.
Correct.
Okay.
And what we basically do is use a little bit of really tiny stitches that are very comfortable. These types of stitches that we use are actually used in ophthalmic surgery for eye surgery. So they're that comfortable. They're very small. I usually compare them to a strand of hair. That's about how they look. Okay. And we use them to really stabilize this curtain of tissue to cover the roots. And the reason we do this is because this glue, the wet glue that we've tried to glue the gums with, the natural glue of the patient, takes a little bit of time to dry. And our stitches will serve us in order to keep it.
So if it's on the upper, it keeps it down.
Exactly. And it allows the patient to actually function pretty comfortably. It allows them to eat food. It allows them to move on with their life without really worrying of messing something up.
So the next day or the next couple of weeks, the downtime is minimal.
Extremely minimal. As a matter of fact, a very common story I hear from patients is, I know you told me I wasn't going to have any pain, but I have none. Is this normal? Okay. And this is obviously, I mean, the best thing a dentist can hear when your patient complains about not having pain and asking you if it's normal. Okay. This is something that happens on a daily basis, and patients are able to go back to work
and these next day. These gums stay down?
They stay down and they attach to the roots because this platelet-rich fibrin, the blood clot, basically promotes whatever patient tissue was there before to make more and repair more of that tissue, making the gums natural looking, stronger, and covering the roots where they were experiencing longer roots or whether they were experiencing sensitivity.
So with gum recession, the gums are not like going away, they're just rolling up if it's on the top or rolling down if it's on the bottom.
Absolutely.
So this allows to go back to where they used to be.
Absolutely. Okay. It really looks back, and I always tell my patients, this is something that I use, I tell them I shouldn't be able to tell that I did grafting in there. If I met you a year later and forgot that I got this done, I shouldn't be able to tell.
How soon does the cold sensitivity go away?
It's an instant.
Really?
Complete.
That evening, they're having something cold.
Absolutely, because the root is covered. The way that the roots transmit sensitivity is because our roots are not like enamel. They're not meant to be on the outside of the mouth. They have little pores that basically transmit temperature to the nerve of the tooth. And when you cover those pores, you immediately get this relief.
Now, we talked in the green room, and I was trying to understand this a little bit better. and you said that it could lead to tooth loss. That means if, like gum recession, because some people don't have symptoms, you said. No cold sensitivity, but they have gum recession. But you say that potentially the next level, the next thing that could happen is they lose their teeth. How?
So this recession is really, really difficult to control. Once it gets every millimeter, and we dentists measure everything in millimeters.
Okay.
So our life is in millimeters, but every millimeter of recession that gum goes down, it becomes faster and faster because the gums get thinner
Okay.
and thinner. So every millimeter goes twice as fast. And it's really difficult to control. Now, the minute it gets really thin, when it's down to 3-4 millimeters, now the patient is so sensitive that they're not only sensitive to temperatures, but they're also sensitive to brushing their teeth. It hurts because the tissue is so thin. It's kind of like scrubbing yourself in the areas of your armpits where the skin is very, very thin. It just hurts. So now they're avoiding those areas.
Well, they have these sensitive toothpastes.
They do. And the sensitive toothpastes are great to protect the roots.
Okay.
But they will not protect the thin, sensitive tissue that hurts every time you pull on it. So now when the patient starts to avoid that tissue, they're starting to brush less and less. They're afraid because it bleeds there.
Sense.
They're scared to make it worse. They're scared to see the dentist because it hurts when they're getting their cleanings there. So they're starting to avoid the dentist. Now it goes even faster because there's inflammation there now because the patient is not able to keep it clean. Food gets stuck in there. Plaque gets stuck in there. And now we're talking about a patient that is so scared and so sensitive that everything is kind of like a loose zipper, if you say.
Okay.
So it's there, but it doesn't really stay. You blow on it or you wrong move and it just goes down. So now it progresses so fast when it gets down to 5-6 millimeters, where you have to remember that when you lose gums, what this means that you also lost bone that was supporting, the bone that was holding the tooth in there.
So the teeth start to get loose?
The tooth starts to get loose. It starts to become really hard to also keep it clean, so you start to get cavities in the tooth.
So it's more than just appearance. Because going into this, I'm under the impression it's just appearance. But no, I mean, this is a way you lose your teeth.
Absolutely. I have patients that tell me, actually, as a matter of fact, I have a particular patient that came and told me that I really want to enjoy ice cream with my grandchildren.
That's
and
nice.
I just can't do that. My grandchildren love ice cream, and they're out there by the pool. They're having watermelon. My husband is having a cold beer. My kids are grandkids are having ice cream. And I just have to keep politely saying no to all of those things because it hurts so much. I just want to be able to enjoy those moments with my family. And this is something that is, priceless when you can provide these people in one day. You can fix this and all of a sudden they can go back and live their life.
Is this one of those things where when you do it, they go, I should have done this years ago?
I hear this.
I mean, do they suffer like for 3 or 4 years before they do something about it? Is it longer than that?
As a matter of fact, I have patients that have been suffering for over 20 years of something like that.
And it's kind of a quick fix in a way, the way you describe it. I mean, it might be technically demanding on your end, but it's kind of a quick fix for a patient.
It is a quick fix, but the problem that we have is that not many people know about it. Not only patients, but even dentists don't know about it. I have patients that have been told by their dentist for 20 years that your recession is getting worse, your gum recession is getting worse, and all they're doing is patching things by putting fillings, bondings, they call them, on the roots to protect them from sensitivity. And when the patient complains and says it doesn't really make it better, it keeps regressing, and it doesn't look that great because it still makes my tooth look long and asymmetrical with other teeth, they say, well, that's what we've got for you. There's nothing else. It's because they don't know
even
their
other
options.
look, I talked to a periodontist about this topic, and they said, really? I mean, it made sense logically that you told me this, that when you put this platelet-rich fibrin under the gums, it grows the gums.
Exactly.
Is that true?
It absolutely is true. It's kind of like when I lecture to my friends, dentists and colleagues, I tell them it's kind of a difference between using a bucket of water to irrigate your lawn, right? If you want to put water on your grass and you want to make it nice and green, and you kind of come out every day and dump a bucket of water on it. Now, what platelet-rich fibrin does, it installs a very sophisticated irrigation system that is there routinely delivering all the
Do they
nutrients.
stay down for a while? I mean, does it last for a long time?
So the platelet-rich fibrin stays in for 14 to 15 days, which is sufficient enough time to actually induce a healing process.
And it makes them strong again.
Makes them strong
Interesting.
again. It
Good.
regenerates them and repairs them, makes them thicker and longer because we pull them down.
Now, what about people like, I noticed this since I was talking to you, like near their eye teeth or canines, like if you have big recession and just like really big recession, is it easy on those areas when it's only a couple of teeth?
Absolutely. It's even easier because you're working with very small areas. It makes it even more comfortable for the
When does the
recovery.
appearance change? Does that take a couple of weeks?
So
couple months, or does it change right away?
appearance changes immediately. What you see is what you get, we tell our patients. You know, I have actually a particular patient that came in a couple of years ago, and she mentioned to me that I'm getting married in 6 weeks, and I just can't smile on this side. I always have to use another side to smile. And I really want to have wedding pictures that are beautiful. I don't want to think about what side I have to use on my wedding pictures. And she said, you have 6 weeks to fix it. I want to be done.
Okay.
And I told her, I said, you'll be done immediately. If we schedule the surgery for tomorrow, you'll have this result tomorrow. So we were able to fix it for her, and she was so thankful because she said she brought us a set of her wedding pictures to show to us. And she said, look, I can use
That's
any
great.
of my side of the mouth, and I am so happy there.
As you told me that the gums frame the teeth, so it makes you look better.
Absolutely.
And look, you're in Beverly Hills, and you have people that travel great distances to see you as well, and a celebrity clientele. Somebody that was getting ready for a movie, you fix their gums right away.
We actually had a very specific patient who is a very famous actress. Of course, I can't name her, but she's pretty famous in a lot of movies. And she came in with a chief complaint saying that I am starting to get responses that I'm not booking jobs because my teeth are not looking right. They can't tell what's wrong with them, but they're saying that they're not looking the same. It makes me look old because her roots were showing in the front and they were yellow and they had a lot of asymmetry to them. So she said, you know, my dentist said that you have a way to fix this very quickly because I need to move on to my next job and I just want to get it done. I never want to hear from another producer that, you know, something is wrong with your teeth. And we were able to do this because for this particular person, she had it on every single tooth in her mouth. And she was suffering through it because she couldn't take a break from her job.
And it's fixed now.
And it's completely fixed. We fixed all of her teeth in under 2 hours.
Okay.
And she was able to move on to her job, like promised.
Now, for people just tuning in, we're talking about gum recession and new treatment options. I guess typically how gum recession is handled, you take like a surgical place on the roof of the mouth, and you with stitches, you patch it to cover, to get rid of the cold sensitivity.
Correct. Transplant.
And with this, you just take their own blood, you spin it, you use PRF, this fibrin, platelet-rich fibrin, inject it under there, use some techniques, and the gums go down.
Correct.
Or up, depending on
and
upper
this
bottom.
platelet-rich fibrin is not only amazing in the fact that it regenerates and repairs tissues, it also is extremely easy to take. It's very inexpensive because it comes from the patient themselves.
Is it about, I don't want to talk about money, but is it about half the cost of these other procedures?
It exactly is, because it really cuts down on how much material we have to buy for.
When were you going to bring that up?
Plus, I mean, you have to remember that most of the products that are out there on the market are animal-derived products. Not all, but a lot of them that are used there. They're porcine, pig
So this
collagen.
is more of a holistic approach.
Correct. I mean, and the, you know, animal collagen is just, it's similar to ours, but it's not exactly the same. So there's always this reaction that happens in our bodies that tries to fight off or not exactly accept other collagen in our mouth or anywhere in our bodies.
You say people avoid smiling because of gum recession.
Most people who come in to see us with us, they will tell us that the way things look on pictures or where they see people, where they go to a job interview, they reserve themselves and they feel like they can't smile because it can negatively affect.
They can't smile big.
They can't smile. They don't smile at all many times because when they do, their smile shows their teeth, which makes them look either older or self-conscious because it looks yellow, like they don't brush their teeth. And it just makes them not feel good about themselves. And we know that feeling good about yourself is about 99% of the battle in this life.
Good. I'm not an expert, but if I'm a periodontist sitting right here and I'm hearing this, could they poo-poo it? Could they say, I don't know, sounds like an exaggeration. I don't know if it works as well as she says it is. Traditional surgery is our gold standard. What do you say to them that are skeptical?
You know, we dentists
Or what could they say?
We dentists are creatures of habit. We're just kind of what we learn in school is just what we do. So I hear this all the time. They're just used to doing it a certain way, or they're ashamed to do it differently because somebody else may say something about their work. But when they take our courses and they see how easy it is and how great the results are, it's an instant switch. It's very
They do
easy.
it. They love it.
They do it. They love it. And we see more and more of periodontists and dentists out there doing this procedure, helping patients all over the world, because this is our goal, not only to do it ourselves.
We have about a minute left, but how old can you be to get this done? I mean, if you've had gum recession for 20 years, does it get to a point where it's too late?
So there is no point where it's too late, or too early, I should say. I've seen patients going through orthodontic work, something just didn't go right and something receded on the tooth. So I've seen patients who are about 14 years old and their parent is really worried. They don't
The braces
want them
come
to
off and you notice.
And that particular kid cannot brush their teeth because it hurts them. So the parent is sitting there. The parent is worried about them losing a tooth. The actual child is worried about losing a tooth. So we can actually help as patients that are as young as 12, 14 years old.
And up to?
It's rare, but it can happen. And of course, I have a patient who, I think my oldest patient for gum recession was 88. And I told her that I don't think you really need to get this done. And she said, honey, yes, I do. I want to live my life like I did 20 years ago. I want to be able to eat what I want. And I want to be able to smile on my pictures.
That's
and
nice.
we got it done. And she was very happy.
Good. We're out of time. Final message to a person watching this. They have receding gums. They've heard what you have to say, but for whatever reason, they want to put it off, or they're afraid, or they're skeptical. What do you say to them?
I just tell them simply, come in, let me take a look. Let me educate you. Let me tell you about it. Let me show you how simple this can be. And you can make that decision for yourself.
Okay, I got to bring this up. You decorated your office to look like your home that you live in.
We absolutely
Is that true?
did.
Is that right?
Yes, we color matched everything because we wanted to host our patients and we wanted them to feel like they're guests in our home. And
So kind of like the furnishings are like your home?
they're exactly like our home,
Interesting.
and the color schemes are exactly like our home.
That's very nice. Dr. Krivitsky, I want to thank you for coming on the show. Great stuff. If somebody wants to make an appointment, do they go online or call your office? What's the best way to go?
There's plenty of information online. They can call our office, and we have great staff that will help them proceed forward.
I want to thank you for coming on the show. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.